Hello, everyone, and thank you so much for tuning in to Where to Begin, How Two Communities Are Addressing Pedestrian Safety. My name is Heather Zaccaro. I'm a program manager here at the National Complete Streets Coalition, and I'm just here to provide a bit of broader context about the pedestrian safety crisis that we face across the nation before turning things over to the two phenomenal speakers we have lined up for today. I'll also be back at the end of today's webinar to moderate a questions and answer session. So while I and the presenters are speaking, please feel free to type in any questions you may have in the chat box in the bottom left-hand corner of your screen. We'll try to leave as much time as possible to answer your questions, but of course if we don't get to all of them, we'll also be publishing a recap blog post after this webinar that will include some bonus answers to questions we didn't have time for today, as well as the PDF of the presentations and a full recording of today's webinar. To start, I want to talk a little bit about pedestrian safety across the nation. Every 2 years, we put out a report called Dangerous by Design that looks at the most dangerous cities and states to walk in across the country. This year, in January, we put out an update of this report using data up to 2017. And the results are tragic, to say the least. We face a particularly I think pedestrian safety has been really problematic for quite some time, but the past 2 years, and based on preliminary data for 2018, the next year as well, we are seeing the highest numbers of people killed while walking that we've seen in 3 decades. This is a problem that impacts every community across the United States, some more disproportionately than others. Pedestrian fatalities constitute a larger and larger share of deaths on our roadways every year. Over the past decade, the numbers have gone up by 35%. And in this time, while we are driving slightly more and aren't really walking very much more when you look across the nation as a whole, we've actually reduced the number of deaths among motor vehicle occupants. We are designing our cars with more and more safety features to protect the people inside of them, but unfortunately, we're not designing our environment and our roads to protect all of the people that use them. Specifically, we tend to design our roads nationwide to prioritize the speed of cars over the safety of all people. Far too many of our streets don't balance the needs of all people that use them, particularly the most vulnerable people, such as people walking and biking. Where sidewalks and crosswalks exist at all, and they may not, they may be ill-maintained. We have these wide roads that we continue to widen to improve capacity, where cars drive at dangerous speeds for all people, not just people walking, but people driving as well. And in many of these cases, these streets are too wide to safely cross, even if there is a crosswalk present, which again, many times there's not. Often there's insufficient time for people to walk across these large, wide, multi-laned, highway-like streets. The outcome of this is that people must risk their lives in order to reach jobs, grocery stores, and bus stops, particularly if they don't own or cannot access a personal vehicle. And there are some really clear trends across the nation for where this is occurring and who this is impacting. Specifically, arterial roads tend to be the most dangerous places in communities. We see lots of clusters of pedestrian deaths over a small subset of roads in many communities. Additionally, certain groups of people also are disproportionately impacted. Older adults, people of color, and people walking in low-income communities tend to be disproportionately killed while walking on our streets. The good news is we know how to address this crisis, and there are many communities across the country that are taking steps to save lives and protect the safety of people walking on their streets, including the speakers from the two communities that you're about to hear from today. I'm going to turn things over now to our first speaker. Megan Weir is the director of the Program on Health, Equity, and Sustainability in the Environmental Health Branch at the San Francisco Department of Public Health, where she and her team work with local communities and government agencies to develop and apply innovative approaches to using health data and evidence to inform safe, sustainable, and equitable transportation and land use planning decisions in San Francisco. Ms. Weir co-chairs the San Francisco Citywide Vision Zero Task Force to eliminate traffic deaths and also oversees comprehensive collaborative data systems in support of evaluation, surveillance, monitoring, and analysis of San Francisco's data-driven, evidence-based transportation injury prevention initiatives. Megan?
Yes. Thank you so much for the great overview with respect to the national context and also the opportunity to speak today and to share some of the work that we've been advancing in Vision Zero to ultimately eliminate traffic deaths in our city. As Heather mentioned, I co-chair the Vision Zero Task Force with our San Francisco Municipal Transportation Agency, and I'm excited to be here today to both give an overview of our Vision Zero initiative and also share two case studies that really focus on community engagement and leveraging data to eliminate pedestrian deaths in our city. San Francisco adopted Vision Zero in 2014. We were the second city in the country to adopt Vision Zero, and since then it's been really exciting to see the number of cities that have also adopted Vision Zero and the great network across the country that is working together towards this goal. And it was with really the leadership of our mayor and our board of supervisors and our department heads that the city really took on this ambitious goal and really increased our commitment and ultimately acknowledging that no deaths are acceptable on our streets. And through this work, core to Vision Zero is acknowledging that people make mistakes and that no one should die when this happens. So on the left slide, we see the traditional approach to traffic safety, and on the right, the Vision Zero approach. And I'd also like to say that this is really consistent with a public health approach to traffic safety, whereas our traditional approach really looked at traffic deaths as inevitable. And under Vision Zero, we really focus on how traffic deaths are ultimately preventable. Under traditional traffic safety, approaching traffic safety is really how can we perfect human behavior, and under Vision Zero, understanding that people are going to make mistakes and the consequence should not be death. Also through Vision Zero, we're really focusing not just overall on collisions, but more explicitly on the worst health outcomes of a crash, that being fatal and severe injuries, and also focusing on less on individual behavior and more on a system-wide approach. So how can we create a safe transportation system that protects all its road users through partnerships with transportation and public health and law enforcement and other agencies. And finally, historically, traffic safety has been seen as something that's expensive, and Vision Zero really focuses on how the costs are too high for not investing in traffic safety. And I think the national data that was just shared really illustrates the critical importance of investments in our transportation safety system. Vision Zero is our city's commitment to creating safer and more livable streets and ultimately eliminating all traffic deaths, including those to pedestrians, but also people cycling, people motorcycling, people driving, everyone using our transportation system, and also reducing severe injuries. We just released our 2019 action strategy, and I wanted to give a brief overview of that work, which is also available online for people who are interested. Our core principles of Vision Zero in San Francisco, consistent with international principles, are again on saving lives and prevention. Also on equity, we know we can't realize Vision Zero if we don't focus on the injury inequities that we see in our system, and also on speed, because fundamentally survival is shaped by how fast vehicles are traveling. So really lowering speeds through Vision Zero initiatives is critical. And also by creating safe streets. So how can we design streets to protect all road users, and also supporting that work with safe people, so engagement, education, also enforcement initiatives, as well as safe vehicles, looking at what can be done with our city fleet, and also given emerging technologies and transportation issues that are happening in our streets, how can technology be used to improve the safety of vehicles in our system. With respect to our equity focus, again, we really cannot realize Vision Zero if we don't focus on the people who are most vulnerable in our transportation system. And ways we can do that include by deepening our community engagement, by prioritizing and monitoring improvements based on data where we see concentrations of severe and fatal injuries, particularly to people, including seniors, people with disabilities, in communities of concern. Also ensuring that our policies consider and address equity impacts and don't exacerbate any existing inequities. Ensuring that our campaigns are multilingual and really focused on community engagement. And also we've done a lot of work on developing and institutionalizing injury surveillance that capture many different aspects of injuries to inform our injury prevention work. And finally, we can't realize Vision Zero without partnership with our city, community, regional, and state stakeholders. This is something we cannot do alone, so partnerships is really a critical piece of this work. Our latest strategy also focuses on the core question of what will it take to get to zero. We're actually 5 years into our initiative, and this is a really critical question that we work to answer with this strategy. So in addition to the strategic actions, which are our city actions, that we're leading, we focus on transformative policies that we need to advance at the state level to eliminate traffic deaths on our streets, as well as how complementary goals, such as goals related to climate change, to improving our transit service, and for affordable housing, how Vision Zero can help advance those goals, and how advancing those goals is also really critical to eliminating deaths on our streets. And again, fundamentally underlying all of this work has to be a focus on equity. I'm not going to get deep into the data systems work in this slide, but did want to just give an overview that we've done a lot of work within San Francisco to link our police and emergency response data to our hospital data so that we can have the most comprehensive surveillance system possible. Again, Vision Zero being really a data-driven initiative, this has been an important focus of the work and something we're really fortunate to have our transportation agency help fund. And linking this data to a lot of other data systems so that we can better understand the consequence and cause of transportation injuries on our streets. And I'll give some examples of this work in our case study, but also have a link at the bottom of this slide for people who are more excited about getting into the weeds with respect to these questions. So in my role for Vision Zero, in addition to co-chairing the city's initiative, I also oversee data systems. And one of the key things that we do is track and report on a monthly basis the traffic deaths that occur in San Francisco. In 2017, we had our least deadly year with respect to traffic fatalities on our streets in over 100 years of recorded history in San Francisco. Last year, we had the second least deadly year on record. Of course, no death or no loss of life is acceptable on our streets. And so while we're hopeful that our investments are going in the right direction with respect to traffic deaths, we have a lot more work to do. As you can see on this slide, pedestrians are the most vulnerable transportation users on our streets. They consistently comprise approximately 2/3 of our traffic deaths. And historically, including last year, seniors are really disproportionately represented among pedestrian deaths on our streets. In San Francisco, we've also identified what we've referred to as our high injury network. And these are 13% of city streets where we found 75% of severe and fatal injuries are concentrated. This has been a really important tool to inform city investments in infrastructure and other initiatives to save lives. And in overlaying our high injury network with what we refer to locally as communities of concern, these are areas that have been identified where we see relatively higher concentrations of low-income communities, communities of color, senior, and people with disabilities that are more reliant on walking and transit. These communities are really overrepresented in our high injury network. So our high injury network these communities have about a third of our city streets, and half of our high entry network is in those communities. So as we use the high entry network to make investments, we're also helping invest in communities that have historically been underrepresented in infrastructure investments in San Francisco. Now I'm wanted to share just a couple of case studies with respect to some of the Vision Zero work that's focused more on engaging some of our more vulnerable populations within Vision Zero. And the first is our Safe Streets for Seniors program. So we've seen really, as I mentioned earlier, that seniors are at increased risk of death and severe injury in San Francisco, comprising just 15% of our residents and about half of pedestrian fatalities every year. We also know based on national data that the average risk of death for someone who's older is much higher at any given speed. People with disabilities are also of particular concern. Many seniors also have disabilities, but also people with disabilities overall we've seen and are learning more are more vulnerable as pedestrians in our system as well. So for this work, our Department of Public Health has really done a lot of work with the Safe Streets for Seniors program to engage seniors and senior service providers around Vision Zero, both conducting outreach and multilingual presentations to seniors and service providers about how to get involved with and inform Vision Zero, but also funding community-based organizations, particularly along the high entry network, to engage and do deeper education and outreach to, again, inform Vision Zero initiatives. Through our work on data systems, we've also been able to do some spatial analysis using both severe and fatal injury data for seniors and people with disabilities, and also working with community organizations representing those communities to also identify what are some priority areas where seniors and people with disabilities both live and travel. And the map on the right represents an amalgamation of all that data, but ultimately what we're able to find is that, I guess not surprisingly, that where seniors live and people with disabilities live and travel are also where people are experiencing more injuries. But the way this map can be used is, again, as another spatial tool to help inform Vision Zero investments, particularly to protect our seniors and people with disabilities. This next slide is just a zoom-in map of what this type of data could look like at a more local level, highlighting again things like paratransit stops, libraries, senior centers, and other important community resources that can be prioritized for safety improvements. Through the community engagement with seniors and people with disabilities, with some of the DPH grants, ultimately community advocates were able to help influence SFMTA to change their policy regarding crossing time citywide. So this slide depicts our advocates giving our city traffic engineer a really nice revised pedestrian walk signal. And then also the map has been used to inform where a citywide campaign focused on really drivers slowing down in some of these same areas, use the map to inform where to put banners and other outreach. Another thing that we have in our upcoming strategy is also a traffic calming program that's going to be targeted at those areas. The next case study I wanted to mention today is on Safer Taylor Street. Safer Taylor Street is on our high injury network. It's the yellow line depicted in the map at the right, which is right in the heart of the Tenderloin in San Francisco. On that street, about one person a month is injured while walking or biking. And this is a project that was led by SFMTA that my team had the honor of partnering with, along with a number of other community organizations as well as transportation firms. Safer Taylor Street was really focused for improvements and also increased outreach, both because of the injury patterns, but also just because of the characteristics of Taylor Street. So including a much higher density of youth and senior populations, a more diverse community. The two maps on the left and the right also depict just the range and diversity of services that are in this area, including a number of health clinics, food pantries, churches, and also this is a community where we have a lot of people living in single-room occupant hotels, so people that are marginally housed, and thus a lot of concentrated services in the same areas. So because of a lot of these conditions, the SFMTA was really interested in how a multi-pronged outreach approach could be used to really better engage the cross-section of communities that live and use Taylor Street. So this approach really both leveraged existing organizations and community groups, and also really sought to use a number of different methods to engage with the different populations. So one was a community working group that was co-led by Walk San Francisco and Safe Passage, both community-based organizations in San Francisco that convene stakeholders to provide ongoing input into the project, and we're really able to reach out to people in the community that normally would not show up to the standard outreach and engagement processes. There are also a number of tabling sessions that were held both on the street, as you can see, and in parks, as you can see at the left, as also in existing meetings. I think a best practice with respect to outreach. I know that a lot of people are using across the country with respect to really going where people are, as opposed to asking people to come to us. A really successful piece of this project was also a tactical urbanism or a pop-up workshop event that really transformed Taylor Street for a day. It was a great way to reach people that are just using the street in their daily lives. There were a number of 3D models in addition to the street transformation that occurred. There are staff on site to provide multilingual engagement and interpretation. And hundreds of people were able to access this event in the course of their daily lives. My team also led a photo voice project to engage youth as a part of this work, partnering with the Boys and Girls Club to take photos and interpret them to also inform the project. This slide depicts some of the findings with respect to the importance of really having public murals and art as a part of the project to really uplift the beauty and really emphasize some of the joy in the community. Additional concerns were with respect to street safety and other types of street improvements that both inform this project as well as opportunities to engage with other city agencies moving forward. So ultimately, the outcome of this community engagement is the proposal that's at the right, which I'm happy to say has been really well received. I think the depth of community engagement has also really helped move it through the adoption process, and we're excited to see Safer Taylor Street being implemented in the next couple of years. Finally, I just wanted to share just some thoughts on getting started. I started this work in San Francisco over a decade ago when Vision Zero was really still something that was unimaginable. And so just wanted to reflect on some thoughts that are hopefully helpful to others at different phases in this process of just thinking of what's the vision for the future for your city and for saving lives. So really starting by meeting with community members and organizations and working to understand community concerns, and also meeting your partners in public health and healthcare and transportation, law enforcement, public works, emergency response, schools, and other agencies. Also, with respect to data, we always know that we don't want the perfect to be the enemy of the good. So really just starting where you are with respect to whatever data you have and working to fill the gaps through the aforementioned partners, and also ensuring that you're looking at issues of equity in doing so. And also working on initiatives drawing on really the strengths and resources of your potential collaborators, understanding the policy landscape and what effective solutions are, and also really starting small with a small project that can help really develop relationships and mutual understanding. So thank you again for the opportunity to speak here today, and I just wanted to share a couple of websites for people who are interested in looking in more detail, and look forward to the Q&A. Thank you.
Megan, thank you so much for taking the time to share your story with us today, and also for all of the great work that you're doing to create safer streets in San Francisco. As a reminder to those of you listening in, we will have some time for questions and answers at the end of the webinar. So if you have any questions for Megan, please type them in the bottom left corner of your screen. Next, I want to turn things over to our second speaker. Daniel Alexander is the Hawaii Bicycling League's co-executive director, leading the organization's advocacy and planning work to make Hawaii more bicycle and pedestrian friendly. He has spent years working on active transportation planning and advocacy. He has a master's from the University of Hawaii Manoa's Urban and Regional Planning Department, where his extracurriculars included co-founding and coordinating Cycling Manoa. After college, Daniel worked as an alternative transportation planner and project manager for the Cape Cod National Seashore and as an urban planner for the planning firm Belt Collins Hawaii. His work at the Hawaii Bicycling League focuses on building community and elected official support, fostering partnerships, and providing leadership and support for the adoption of policies and implementation of bicycle and pedestrian projects. Daniel?
Thank you for the introduction, Megan. All right, so I'm going to talk to you today about some of the work we're doing here in Hawaii. I'm going to give some brief background on Hawaii Bicycling League and why we're working on pedestrian safety-related items, a little introduction to Hawaii, and then I'm going to focus in on our solutions meeting program that is trying to achieve 0 deaths and improvements on the streets. And then finally, I'm going to finish with kind of some of the state of affairs, both for adoption of Vision Zero here in Hawaii and some other related efforts. So just jumping in, Hawaii Bicycling League, we're a nonprofit with a mission of getting more people cycling and doing that through advocacy, education, events. Those are kind of the function areas of the organization. And on a staffing level, the majority of our staff actually works on education, which starts with a youth bicycle education program and then goes all the way to seniors. And we also have driver-related education. We've been around for a while, since 1975, part of the national movement of bicycle clubs that were started and evolved into full-fledged nonprofits working on different fronts. And we're a member-based organization with a little over 2,000 members. So how did we end up working on pedestrian safety? So I'm going to take you through this journey with some of the policy, and this will give you some context for Hawaii and Honolulu. So in 2006, there was a charter amendment in the City and County of Honolulu about whether we should be a bicycle and pedestrian friendly community and whether that should be a priority of the city. So we, of course, pushed full force behind that, and it really brought us to align with organizations and entities and community groups that more saw their interest in pedestrian safety than bike safety, but it led to some partnerships and collaboration. And that really paved the way for, in 2009, the state adopted a complete streets law that both made it the policy of the state to have a complete streets program and mandated that each of our counties establish their own. And again, that unified a lot of different partnerships around pedestrian and bike safety, but also in the broader context of traffic safety. In 2012, we adopted at the city and county level a complete streets ordinance, a very strong ordinance that established a lot of procedural ways that complete streets have to be implemented, and has really paved the path for a lot of improvements on the ground. During that same year, we really took a leadership role on pushing for a vulnerable users law, which, for those that aren't familiar, vulnerable users laws provide for escalated penalties for drivers that kill a vulnerable user, someone walking, bicycling, someone, an emergency responder, a construction worker, and so we were able to get a large coalition to support the realization of that law. And then finally, in 2016, and I'm really including this to show that Complete Streets really has been a journey. Even though we trace it back to 2009, it's still an ongoing effort. So in 2016, the City and County of Honolulu adopted a new Complete Streets design manual, and this replaced road design standards from the early 1980s. So it really represented a revolutionary change and update to the design practices of our city transportation department. To our City Department Transportation Services credit, as part of really embracing Complete Streets, they did a ton of training, and they adopted 20 sites to do designs for, where they were able to include a broad subset of the planners and engineers and other relevant partners, people that would be involved in maintenance and whatnot, to figure out what these new types of designs looked like. And I think now what we're starting is more realization of those Complete Streets projects, which granted that it took more time to kind of take hold than we as advocates were hoping for, but it ultimately it's really set us on a good path. All right, next up I'm going to talk about some programming. And part of the reason I'm talking about this is to give some context of how different entities really can support nonprofits in doing this sort of work and really guide things in a positive way. So in 2012, we received a NHTSA grant to do driver education and bicycle education, but because it was kind of a broad-reaching grant, they really wanted us to do pedestrian safety as it relates to drivers in addition to bicycle safety. So it really pushed us to create a program that was focused on how drivers could operate safely around bicyclists and pedestrians. And that really has become a foundational part of our education programming. And then what I'm going to talk about in greater depth, our solutions meeting program. I just wanted to point out that it's been made possible in large part by our State Department of Health funding that program. Really they see it as part of their injury prevention. So just to call out to whatever your agency is, or you could have a role in really enabling others to do some work that maybe your agency can't directly do, but you can provide support for a nonprofit to do. All right, going to do just a brief overview on Hawaii to give you some context. So we have about 1.4 million people. About 1 million of them are on the island of Oahu, which is a single city and county of Honolulu. Just briefly, in Hawaii, we have no city governments. We only have counties, and we have 4 of them. And those are shown there on the map with their populations. And then the percentage that's included there is the walking mode share from the American Community Survey. So you see that in Honolulu, which is where most of our population is, it's over 5%. And then on the other islands, there are less populated and definitely less densely populated. The walking percentage is much closer to 2%, so significantly lower. So how are we doing around pedestrian fatalities? We had been showing a slight downward trend. So those are the total fatality numbers there for each year, and then the 5-year trend. So as of 2017, we've been showing a slight downward trend, not particularly abrupt decline, but a general downward decline, which is a positive thing. Okay, so and how do those break down on a county by county basis? The vast majority of them are on the City and County of Honolulu, and then smaller amounts in the other counties. So some element of exposure, and that the exposure is a contributing factor in the number of fatalities. So what I said about us being on a slight decline, steady decline, going into 2017, which was a relatively low year for pedestrian fatalities. Last year, 2018, we had a tremendous spike. Actually, the number ended up being 44 pedestrian fatalities, which for the first time in recorded Hawaii history, the pedestrian fatalities outnumbered the occupancy vehicle fatalities. And that's for the whole state. That's not just for a city area. The next slide is injuries. So one of the main sources that we can count on for injuries is those reported by our emergency medical services, ambulances, and that's collected by our Department of Health. And what's really noteworthy about this is, in spite of the fact that we were seeing a downward trend going into 2017 for pedestrian fatalities, if you look at the numbers of injuries, we actually were not experiencing a downward trend. We were experiencing a slight increase. And the extraordinary increase that we saw in 2018 isn't really reflected in the injuries. So I think it's important when you're looking at fatalities to also put them in the context of injuries. So when we were talking in 2017, everyone was giving each other kudos for the massive drop in fatalities, whereas when you looked at our actual injury rate, you saw we weren't doing particularly great. One other thing on the makeup of the pedestrian fatalities, the elderly are definitely overrepresented, considerably overrepresented. We have a lot of aging in place, common dynamic across the U.S. And it's one of the dynamics is people older walking are being killed at just alarming numbers. At some point, the Dangerous by Design report had us, the City and County of Honolulu, as the most dangerous community for walking for those over the age of 65. And that trend hasn't really abated. So what are we doing about it? So I'm going to jump in. I'm going to talk about our solutions meetings program as one of the things that we're doing. So what is the solutions meetings about? Okay, first we're trying to get to solutions. Second, we're trying to humanize the statistics. We're trying to get beyond the number and into telling some of the human stories and connect with people on a different level. That this was someone's daughter, this was someone's friend, and we're trying to further overarching policy and program changes. And then I think on the Vision Zero front, we're really trying to instill a systematic approach, which in my assessment is really the fundamental part at the bottom of Vision Zeros is a systematic approach to achieving reduced and ultimately zero fatalities. And I'll just note, we borrowed this idea from Seattle Greenways, a chance encounter with Kathy Tootle, who was, I think, then the executive director. And she told us about this program. We said, hey, that's fantastic. Let's adapt it here in Hawaii. So I'm going to go through what our solutions meetings kind of by focusing on one specific solutions meetings that we did. So this one was in regards to Cecilia Palarone, and she was an 86-year-old woman. She was crossing the street right literally in front of her apartment in kind of the pre-dawn early morning hours in a marked unsignalized crosswalk. And she was struck and killed. As the news reports, they always like to put the where that is as a count in relation to the previous years. And this was in December, and at that point she was the 53rd of 53rd traffic fatality we had experienced on Oahu. And I included her obituary really because I think, as I was trying to say, we're trying to humanize this. And when you look at the number 53, of course that sounds terrible, but to keep in mind that there's a story behind every one of those people. All right, so I think some of the critical elements of solutions meetings is definitely getting the right people there is fundamental. So this is a picture of the group that met right there steps away from where Ms. Palarone was killed. And so, all your relevant agencies, and I think keep in mind that the agencies that are responsible for our roadways sometimes are multiple. So in our case, our Department of Facilities and Maintenance has a really key role in maintaining our roads and executing a lot of changes, whereas our Department of Transportation Services is the one that puts in the request for those changes and does the analysis on what's appropriate. So really important to have your elected officials and other elected entities on board. In our case, we have a neighborhood board system, and really that's kind of a very localized form of elected government. So including all levels from your state representatives to your city council members to lower levels of elected government. Some of the other critical government agencies that are important to include, your first responders, whether it be fire or emergency medical services. Often they have an abundance of information on specific areas and general trends and issues. And in our case, our Department of Health, State Department of Health, has been extremely supportive and is just a great source of information and data on what's going on. And then area businesses and residents are, of course, crucial to bring on board. They have just the most valuable input in many cases, and their buy-in is essential for any changes. And then families of the victim, there's no way to humanize something like having, in this case, we had the sister of the victim present at the solutions meeting. And really when a transportation engineer hears someone talk about how dangerous to cross the street and their sister died in that crosswalk, and it has a really, I think, profound impact, and just brings home the human element of how serious work is relating to our streets. So information, it's crucial to bring the right information to the meeting. So you really want to come, and one of the things to I think always contextualize with is sometimes a fatality in a particular instance is going to be dismissed as a fluke. It was just a drunk driver, or it was just really specific to that particular incident. And when you have the crash history of what's happened on that intersection or what's happened on that corridor, you can really say, hey, this was part of a bigger trend. We should have been able to look at the numbers ahead of time and said something bad was going to happen here, and been able to take preventative action before someone died. In this case, there were multiple pedestrian injuries in the previous 5 years at the crossing in question. So it's also really good in our Department of Health and our police department and our transportation department. They're able to get a lot of those crash numbers, an advocate pushing them in the context of hey, we're going to have this meeting, and we really need you to bring the right data to the table so we can have an informed conversation, and start to break down what are the contributing factors in those other crashes, and that really will shape a very solution-driven conversation. And then it's useful to have things like where does this sit in relation to any planning documents you have if you have a pedestrian master plan. In our case, we don't yet, but we do have a bike plan. If you have traffic counts that can maybe give you some feasibility on what operational changes are possible. And then to really emphasize the local knowledge component. So it's in this case, when those residents and the area business owners were speaking, they just had so many stories about near misses, just chronic speeding issues, chronic failure to yield in the crosswalk issues, and they were really able to give the data a deeper depth of the experience of people there. And we've done a large number of these solutions at this point, and I'll tell you that pretty much every community, when you get down to it, and these are ones where someone died, but that does tell a lot about it, but has concerns about speeding in their area and unsafe driving and conditions. And then finally, it's really important to bring some understanding of the possible solutions to the table. So that's some understanding of where certain solutions are applicable, where they're possible. And I'll give an example of four-way stops are an ever popular solution amongst, I think, the general public, and yet most design standards do not allow four-way stops where in many instances where the traffic is heavier on one direction than the other. But there might be other solutions that you can bring to the table, like a pedestrian safety crossing median that would have a similar benefit of what end people are trying to get to. So I think really important to have some understanding of solutions, and having your, like you said, your planners and your engineers there that can quickly kind of eliminate the infeasible solutions and concentrate on the more feasible solutions, so you can end up with a positive list of actionable items. So I've already started jumping some into the focus, but it's really important to, you're trying to get to actionable solutions, actionable engineering, education, and enforcement solutions. In this case, we both use the particular case, in this case, Ms. Pallarone, but we don't limit our analysis and conversation just that instance. In her case, it occurred in the pre-dawn in dark hours, so we didn't just limit our conversation to talking about lighting issues, but we talked about in the context of the other known injuries and everything the residents were reporting, what the multitude of issues were in that intersection, in that corridor, and how we could figure out solutions to decrease the likelihood of another tragedy happening. And I think really important because we do these in relatively close temporally to the fatality. So the police generally do not have any information to offer up on an active case. So you really can't dig a whole lot into it, but you can use all those other data points to have a really informed conversation. I'll just say one thing. Impairment, driving under the influence, is an extremely common contributing factor. As I think anyone who's looked at the data knows, it's maybe half of all the traffic fatalities, at least here in Hawaii, have impairment as a contributing factor. And it's a little easy to just say, hey, the person was drunk. What could we do about that besides have more DUI enforcement and better DUI laws? But there are a lot of other things you could do to say reduce the person's speeding, and those would have not just benefits in regard to someone that's impaired, but 24/7 for everyone. And then you also want to make sure you get to some commitments, both small and large. Some of those are on the small side are maybe refreshing faded signs. If you have speed limit signs that have faded out, and your facilities department can commit to those. Some of them are really large actions, like say a road diet. All right, and then I think really important to follow up on everything. In this case, one of the major solutions ended up being a road diet in this corridor. And as the city transportation department went to pursue that, we needed to keep telling the story of why this was an important solution, why there was a problem. And I think that's key to ultimately realizing the solutions. Here, happy story, the solution was ultimately implemented. So one thing that we have done in cases is tie a solutions meeting with a memorial. And this can add to humanizing and kind of expand your reach in terms of participation. And really can serve as a point of community mourning, both for the families and the broader community, and really not letting traffic deaths be normalized, which I think is just a major thing we're fighting against. And I realize I'm going a little long, so I'm going to jump quickly over the state of affairs. So we do have several Vision Zero items moving. So both Maui and Hawaii County have adopted proclamations and established task force that in just the last 6 months. In Honolulu, we had a City Council resolution adopted urging our administration to do Vision Zero. And to that end, now our Department of Transportation, or City Department of Transportation, is pursuing funding for a Vision Zero action plan, which I think in many ways is modeled on San Francisco's program. It has the high crash network that Megan mentioned earlier. But I think to our City Department of Transportation's credit, they've been hesitant to just proclaim that they're a Vision Zero community and more interested in, okay, what are the elements that would contribute to us achieving these outcomes we want, and let's put that forward before we make this formal declaration. And so I applaud them, and that's what they're doing with this Vision Zero action plan. At the state level, we are currently working on 2 bills that would make Vision Zero the policy of the state, and in one case mandate the counties to adopt their own. The one that establishes the task force and has the county mandate is definitely the one we prefer. I put those 2 pictures there in the bottom, again, to just emphasize how much humanizing traffic fatalities is crucial. So in January of this year, we had an incident where a driver ran over a pedestrian median and killed 3 people and injured a number of others. And I think it really led to outrage because it was so it was just so exceptional that it led to really an outrage that I think helped us denormalize traffic deaths and traffic violence, and I think has helped drive forward some of these policies. And then just extremely quickly say some of the other things we're working on. We're at the Honolulu City level, we're working on our first pedestrian master plan. We're for the first time doing projects where a complete streets rehab of streets will extend beyond the curb. Previously, we had just focused on the asphalt area, and now we're actually looking at how we can improve beyond that into the sidewalks. We recently, in the last year, had an ordinance that for the first time allows for the city to fully fund sidewalk improvements. Previously, we had an improvement district program. And one thing on the automation front, we're working on and hopefully in good shape to have a red light enforcement camera program, and the enabling legislation is something we're working on. So with that, I conclude here. There's my contact information.
Thank you so much, Daniel, for your words and also for your work. And thank you to everybody who has already submitted questions for our presenters. We do definitely have more questions than we're going to have time to get to over the next 6 minutes. So I just want to remind everybody that we're also going to follow up with a recap blog post that will also include more answers to the great questions that you've asked. I'm going to start with a question that is meant for Megan, but I think both speakers will be able to address. The question speaks to the main challenges and barriers that you face through your Vision Zero initiatives. Megan, the participant specifically wanted to know about challenges and barriers related to your work on tactical urbanism, but I'd be curious to hear from both Megan and Daniel about the main barriers that you face in this work more broadly.
Thank you. This is Megan. Well, I think with respect to the tactical urbanism, that was definitely, I just have to admit, that was a heavy lift that was really led by our transportation agency. So I'd be happy to follow up for the blog post with respect to the challenges and barriers. So I imagine, it was definitely a real resource commitment, but fortunately that was a project that was really funded for in-depth community engagement, and so there were a lot of hands on deck with respect to, my staff was helping move trees at 7 in the morning, and just getting everything set up and taken down, and with respect to those logistics. The question with respect to challenges and barriers overall, of course there are a lot. But I think also, to kind of touch on some of the other questions that are, populating the questions, Vision Zero really is zero is really the only defensible goal. So I think, doing what we can to really, having zero as a really data-driven goal, and something that our city has overall been committed to, I think has really helped address some of the challenges that are kind of inherent in the issues of traffic safety that I think Dan also did a good job of, highlighting in his presentation. So, thinking back to pre-adoption of Vision Zero, so many different city agencies are responsible for traffic safety, and have an important role to play in the solutions, including, of course, the transportation agency, as well as law enforcement, public health, planning, the fire department, our emergency services. I'm forgetting other really critical stakeholders, not to mention, the level of community engagement. But I think, with mayoral leadership and leadership from decision makers in adopting Vision Zero, that really helps with respect to establishing like the political will that is really needed, including with support from our department directors, to bring everyone to the table to really help start to begin to address what potential solutions are. I also think another barrier overall to something as ambitious as Vision Zero is, how can we even begin to solve this issue? And I think that's where the data analysis and the high injury network in particular, and with respect to really understanding, where are these concentrations, and these concentrations, as seen in the dangerous design report and in similar analyses across cities, are often very heavily concentrated on urban arterial roadways with very common characteristics and speeds. So I think, getting everyone to the table and also working to collectively understand the data and where to begin are barriers, but also challenges that can be overcome with respect to making progress.
So I know we're about to wrap, but can I actually respond to a different question? So there's, I think one of the last questions is relating that the San Francisco program is more systematic and the Hawaii program is more reactive. And I definitely, I actually agree with that statement. And I'd say that there's a process. And, I think we look to San Francisco, and I think, the fact that we're emulating their planning approach. But I think different communities are in different places with this. And so when we started our solutions meetings and stuff 3 years ago, the point wasn't that this was ultimately the best way to do planning. It was that this was an approach that we could take that would start to say that one, traffic fatalities are unacceptable, and that we need to be putting safety first and have a approach that's going to get us there. But two, that we need to be looking to the data, we need to be looking to the information, and ultimately we need to get to a systematic program. And so I think as an advocacy organization, it was really important for us to start to build that. And really we were talking about Vision Zero and systematic approaches the whole time. And it was, I think advocacy and community organizations can only do so much, but they are, I think, trying to set the groundwork both at a political level to have buy-in, but also at a, department level where there's, understanding of what it means to have a systematic Vision Zero approach, and where they are thinking about that and kind of cue them to jump into it.
Thanks so much. Unfortunately, we're about out of time, but as I've said, if you asked a question that we didn't answer here today, we are going to follow up and answer those questions in our recap blog post, so don't worry, we haven't forgotten you. Stay tuned for those answers. I just want to close by thanking all of you for joining us today. We hope you found this presentation to be valuable and that there are lessons that you can learn from these two initiatives to take back to your own communities and work to create safer streets for people there. And I especially want to thank Megan and Daniel both for all of the great work that you're doing and for taking the time to share these stories with us today. We will be continuing this webinar series, so stay tuned for more information about upcoming dates and topics. And once again, thank you all for taking the time to join us today.